Back pain. Next to the common cold, it is the second most common reason patients visit their doctor. In fact, Americans spend over $50 billion each year on back pain, the leading cause of disability in Americans under the age of 45, and the third cause of disability in those older than 45. Historically, traditional lumbar spine fusion was considered the best surgical option for patients with debilitating back pain. This invasive procedure required large incisions, a lengthy hospital stay, and months of recovery time. Now, advances in surgical techniques and technology have transformed spinal surgery into a minimally invasive procedure that addresses the same source of pain safely and returns the patient to an improved lifestyle.
We can identify problems based on patients' age or activities. Athletes are prone to overuse injuries. Older people are basically degenerative problems from being sedentary. And then there's workers who basically overload the system, lifting injuries, or sometimes be traumatic injuries like motor vehicle accidents.
The diagnosis is the key, the linch point, if you will. And to get a good diagnosis, an accurate diagnosis, requires a thorough and comprehensive history and physical examination, and oftentimes tests that corroborate what you believe as a doctor is the source of the pain. So the pain generator from a typical ubiquitous complaint like back pain is what we sought to achieve each and every time we see a patient.
Doctors Dwyer and Vessa are both board-certified orthopedic spine surgeons and have over 45 years combined experience in spine diagnosis, treatment, and surgery. They practice here at the New Jersey Spine Institute, the Garden State's premier medical facility specializing in both surgical and non-surgical diagnosis and treatment of spinal conditions.
The mission of the New Jersey Spine Institute is to identify and early accurately diagnose the particular problem that is causing the patient's pain. Then to return them to function in as minimally invasive a way as possible, but in a definitive way. So if it's physical therapy, so be it. If we need spinal injections, that's helpful. And sometimes it does require surgery, but in the end, we want the patient back to function, back to their pre-injury level as quickly as possible. We review each other's cases, we assist each other and do surgeries together with each other, and we've got very well-trained clinical staff who are very attuned to patients' problems and how to identify them and when we need to intervene.
We see patients in our practice that have been in many other places. Either they've had surgery or not had surgery, but are not satisfied. And then we have to try to figure out what it is that makes them better and then actually enact a plan and make them better. And then get the patient back to their regular lifestyle.
Specializing in state-of-the-art spine surgery that can be performed here in its own on-site surgical center in an outpatient setting, the skilled, caring New Jersey Spine Institute team is uniquely trained and certified in the latest techniques medical science has to offer.
We've had some major technological advances in the field of spine surgery. That allows us to perform more comprehensive surgeries through smaller and smaller incisions. We have greater illumination so we can see better. We have imaging studies that help us identify where we're going to go or map where we're going to do our surgery. We also have special x-rays, fluoroscopic x-rays, that allow us to target our area. So we can do a surgery that used to require a 6-inch incision through a less than 1-inch incision. Less blood loss, less chance for infection, and increased mobility afterwards.
Outpatient settings, typically in surgical centers, are places where people go who are quite healthy and having elective procedures done. They are not sick patients. When you go to a hospital, you're mixed in with all the sick patients. Because of that, there's a much higher chance of getting a wound infection. Surgical site infections are what plague every doctor that does surgery in this country.
Over the last 3 to 5 years, progressively worse pain, constant, got to the point where couldn't stand for more than 90 seconds without sharp pain. Tried physical therapy, tried chiropractor. Finally, doctor sent me to Dr. Vessa. The procedure I had was fusing the discs together, doing bone grafts to basically sustain the back muscles, and then putting pins or screws in that further sustains it, keeps things in place. The best part about being pain-free is being able to stand without pain, being able to walk without pain. Now I'm back amongst the healthy again.
Here at the New Jersey Spine Institute, we're very excited about the concept of human stem cell treatment. That's using human cells that are harvested from the bone marrow, where we can actually repair injured structures in the spine. So as opposed to removing part of a disc, fusing a disc or stabilizing a disc, we're going to be able to repair it by doing an injection as opposed to making an open incision in a large surgery.
I think it's very important for all patients to understand if you seek treatment for pain in your back, in your neck, wherever it may be, you should be very satisfied with the explanation you get from your doctor as to what he believes is wrong with you and how he believes it's going to be fixed.
Obviously, spine surgery is always a very daunting concept to people. I'm usually the last person that people want to see. But what you need to know, if you need spine surgery, it'll occur when you've tried all other conservative measures, which may be physical therapy, injections, bracing, bed rest. But when it comes time for surgery, you want to make sure you go to a board-certified surgeon who's done accredited fellowship in spine surgery, and that's all they do.
There are new advanced techniques available in spine treatment and surgery. If spinal pain is affecting your quality of life, contact the New Jersey Spine Institute today, specializing in solving back problems from the simplest to the most complex. For more information, visit njspine.com or call 908-234-9200.